Well, progress on the front line on Maui as United Public Workers members on strike at Maui Health System get a boost from local lawmakers. The Maui County Council took up a resolution introduced by Councilmember Gabe Johnson urging Kaiser's Maui Health System to stop stalling and meet in good faith with United Public Workers member negotiators to end the strike.
These large organization owners are not connected to this place, and it shows in how they treat our people, our lifeline. I'll say it again. These workers are the backbone of our healthcare system. In fact, I would say they are the heart of the healthcare system, and they deserve the respect and to be cared for.
Council members stood with UPW workers on Friday denouncing the corporation's attempt to profit off the backs of hardworking healthcare workers after they put their lives on the line during the global COVID-19 pandemic without hazard pay.
When Kaiser took over management of our hospitals, they promised the state that they would provide quality patient care. However, their actions to underpay medical staff is contrary to that promise.
Councilmember Shane Sinesi spoke out against Kaiser's failure to meet employee demands, adding the company is putting the community at risk and even questioned their right to hold on to the state-run hospital contract.
Kaiser wasn't the only bidder to manage our medical system, so perhaps this may be the time for the state to reassess, reevaluate the contract with Kaiser in order to better serve our kupuna, our patients, and our residents. Thank you, Chair.
The Daylon County Council session was filled with emotional and passionate testimony from healthcare workers who repeatedly pleaded for Kaiser's Maui Health System to do the right thing and care for the caregivers caring for the community.
It's so heartbreaking that all our effort and our hard work, the care that we put in for our patient, is never been seen by our management.
UPW State Director Kalani Werner, who has been on the picket line, living and working on Maui since the strike began, left a last-minute scheduled negotiation with Kaiser's Maui Health System to testify at the council meeting, providing council members with some insight from those interactions.
They keep belittling the members and they keep taking advantage. I can't compare it to the Big Five. The closest thing I can compare it to is plantations, where they're taking advantage of the workers day in and day out. And it's because of these people's big hearts that they care for the patients and they love the patients that they keep coming back to work in unbelievable work conditions, poor conditions day in and day out. And they still make that sacrifice, hold down 2 to 3 jobs just to be able to survive in the cost of Maui.
Support from the community for healthcare workers on the picket line has been overwhelming, and some of that carried over into testimony at the council meeting. Ann Picately, a retired nurse at Maui Memorial Medical Center, gave a stark warning about conditions at the hospital and spoke about forced mandatory double shifts.
So some are working 16-hour shifts. They're probably for 8 or 17 hours, including the breaks. And that's not safe. That's a dangerous situation. So it's a risk to patient safety, and I just want to say that this is a crisis that has to be resolved.
The County Council unanimously adopted the resolution and now stands on record urging Kaiser's Maui Health System to not only return to the table, but to bring a fair contract that addresses the current crisis of poverty wages, mandatory double shifts, longevity pay, and hazard pay. The union has said members are standing strong and will continue to hold the line until those issues are addressed in earnest at the negotiating table and an agreement can be met. Maleko McDonald, United Public Workers.